Right, now there are fears that COVID-19's fourth wave could derail the full opening of higher education institutions. However, it's not expected to disrupt learning as severely as the second and third waves. Many institutions have announced they will not allow unvaccinated staff nor students onto their campuses. So let's chat now to the CEO of Higher Health, that is Professor Ramneek Ahluwalia, who joins us now. Thank you so much for your time, Prof, and good morning to you. There are fears that COVID-19 might continue to derail, or at least the curriculum and normal schedule for higher education. I suppose you're of the view of this as well. Why do you think so?
Thanks, Tumelo, and good morning to everyone. Happy New Year. Tumelo, you're absolutely right. You know, we have opened our institutions, well, it was in 2020, in 2021, but the predominance has been that the 30% of our curriculum that the academic year ran was on in-contact learning, while 70% was in online. And I'm now talking about the whole sector, which includes urban universities, rural universities. I'm talking about technical colleges, vocational colleges, community colleges, private education. So it's quite a big system called the post-school system. And there has been now a big demand from the parents, from student bodies, around the issue of in-contact learning, which means staying together in residences and congregations for in-contact learning. And this has risen to a number of universities embarking towards consulting a policy in terms of, well, they're saying, let's have the vaccinated people come in the in-classroom activities, let the vaccinated people access libraries, access the congregations of staying together in residences, whereas the people who are still not vaccinated or preparing to be vaccinated do the online, which will help the system to move into a 70-30 split, which means at least a 70% will go into a full in-contact learning, while the 30% will still be moving into the online system, which will be exactly what the economic system wants, the skills development programs. You know, we've got courses like medicine, the bit I am in from, or engineering, or colleges like plumbing, where you can't teach online, you know. So things have to change, and that's exactly where the system is moving into.
Prof, should there be concerns of protests, either from students or even staff that choose to not be vaccinated and who want to have in-contact learning, or in the case of staff members, I suppose, in contact with, you know, their officers and their colleagues and the students with which they serve? Should we expect such protests to erupt or even mushroom around the country due to these policies that we now speak of, consulting on mandatory vaccinations on campus?
See, look, it's too difficult to preempt that question, though, but what I can assure the viewers at this moment is that even though all the universities that have taken the decision of moving into something called regulatory vaccination program are still not completely made that decision. They have passed as resolutions through the Senates, but they are in the phases of consultations. And that's the key word. You know why? Because that brings the population along with you. And we are hoping that these consultations with every section of parents, students, and academia, in terms of unions, will help people to buy into why they're moving into this direction, what will entail for students who will not be vaccinated versus students who will be vaccinated. And similarly, it goes with the staff component. And I think that process will be the defining decision maker of whether we will have protests or not protests. I do think a good consultation process, taking people along, making them understand the science, the reality of why it's been put into what's congregation, why the fears of us having so many cluster outbreaks happen quickly, is going to alarm people and make them understand the decisions around.
What about residences? Because we can't talk about, higher education without residences. We know that most students, at least some of them traveling or coming from other provinces, into other provinces, for example, Eastern Cape to Gauteng to study there, they need accommodation. How do you think that will be tackled, just in terms of ensuring that one is safe, that, your roommate, if you are sharing your room with someone else, is also safe, especially in in a pandemic. How do you think accommodation residences, on-campus residences as well, will handle this pandemic?
So since the invent of this COVID-19 and through all the phases, we've seen major cluster outbreaks in residences. In fact, if you look at the fourth wave, which we are currently experiencing, it started at one of our residences where we first saw a huge cluster of students becoming positive at the same time. But what we've been managing is we've got a protocol called Protocol for Residences, the wardens, resident officers, or house mothers. And the whole challenge has been is making us understand how we work in a congregation setting while people were still unvaccinated. But now with this new policies coming for mandatory vaccination or regulatory vaccination, it clearly speaks to the fact that people accessing residences should be the people who are vaccinated. But what we have also now moved further is that, what we had was in the previous past, which I spoke about, the 30-70 split, because less students were coming inside the system, we had single room facilities. We have made it possible so that very much people who are in dire need for residence still stays in the residence. They continue to stay over the last 2 years while the pandemic continued. But now moving ahead, it's moving with that policy of regulatory vaccination, thinking possibilities of people who are only vaccinated to be congregated together in the same rooms. And I think what the protocols will do for us is defining how we can still establish small isolation sites like we have established per institute, per campus, so that if students clusters outbreaks does happen, if students do become positive, how do we can quickly break the chain of the transmission by isolating positive students from the students who are not positive or not showing symptoms. And I think that's a new protocol as we speak about in terms of isolation and quarantine. So I think that's the factor of how we're moving into. But at this moment, the system will be about vaccinated students coming together into the residences and communicating together.
All right, we'll leave it then. I appreciate your time. Professor Ramneek Ahluwalia, CEO of High Health, thank you so much for your time this morning.